What would you tell the spouse or significant other of a man who has been abused and or sexually assaulted?
What do you do if you're the wife or the girlfriend, the significant other, and you learn that your husband, your boyfriend, your fiancé was abused as a child, might have been beaten, might have been sexually assaulted, maybe was aware of it all the time, maybe repressed it and just recovers this memory. But at any rate, this is your husband, your boyfriend, and he wants help. He wants to see a therapist. But what's your role? What do you do about this? You know, this is different from many other trauma situations. If it happened a long time ago, the trauma can be suddenly dealing with it, coming out of the closet. Sometimes coming out of the closet means that your conscious mind, your awareness, is receiving this, and it's been hidden even from you. It certainly depends on the man. Most men who, and I guess I shouldn't really say most because I don't really know. I'm assuming that most men who would seek help for this would want the women who are closest to them to be aware, to still respect them, to be available to talk if that's what the man wants. I don't think it's a great idea to push him further than his comfort level. It is good to know that most therapists have dealt with this situation or situations close enough to it so that a therapist ought to be able to listen attentively, create a comfort zone, allow the story to come out fully. I'll tell you about a story that I'm quite familiar with, where the couple are very close to me as friends and as colleagues. And this man was seriously abused at age 4 and then sexually abused between age 10 and 15. Had no memory of it when he married his wife. And then, I can't remember what stimulated it. It might have been a movie. Something did, and it all came out. And he was a changed person. The difficulty for the wife was not so much dealing with his trauma story. It was dealing with his personality change, which was from a gregarious person to someone who was very depressive and withdrawn for a long period of time. And I guess all that shows is that these cases can be profoundly different. And the wife who deals with this can't have a guidebook that says, here's how it's going to be, and here's what you should do. In general, you should be patient, loving, and sensitive.